subsequently approved by the Interagency Task Force after going through the execom of DOH. Next slide, please. So you'd find here in this slide our total cases for now. No, so this as of the current time, we have this was July 29. No, so if you'd find we have a total active cases of 56,528. Also, you'd find that our recoveries here are just at 32%. So I want for all of you to understand that with this slide, you'd find that we have a lot of active cases. And if you try to analyze it, our asymptomatic and mild cases would comprise about almost 98 or 99%, and only less than 1% would be the severe and the critical cases. So by having that kind of numbers, we expect that these mild and asymptomatics are all would be eventually, they are the ones at the higher possibility of getting well in a matter of 14 days. Next slide, please. So this slide would show you our current usual or the usual interpretation of what we have right now based from the implementers that we have, local governments, hospitals, and the other reporting units. So we have issued out Department Memorandum 2020-0258, and this was endorsed by the clinical practice guidelines of our infectious societies and our technical advisory groups. Wherein the mild patients or those without symptoms are tagged as recovered 14 days from the date they had their symptoms, or if they do not have any symptoms, from the date the specimen was collected. There has been these studies also that we were also able to inform all of you that at the 10th day of illness, the risk of transmitting the virus to other people is significantly reduced. So for those who had never had any symptom at all, meaning those who are asymptomatic confirmed cases, this is relatively straightforward and follows the 14-day isolation management protocols in our clinical practice guidelines, wherein the patient undergoes 14 days isolation from the day the specimen was collected, with day 1 as the date as the date where we start, as our reckoning period. This is the date of the specimen collection. And then after 14 days, after the assessment of the physician, and the patient remains to be asymptomatic for these 14 days, they will be tagged as recovered because they already have completed the 14 days isolation. Next slide, please. Now, this slide would show you also the interpretation now for those who has had symptoms. So the common interpretation would be to wait for clinical recovery, such as there is no fever anymore for at least 3 days, there is clinical improvement, or they had been discharged from hospitals. Then they undergo additional 14 days isolation after clinical recovery, with day 1 as the day after the case has been assessed as clinically recovered. So pag tinignan po natin, instead of just having 14 days, the common interpretation would be from the date that the patient has been diagnosed or has had the onset of illness until the patient has been declared clinically recovered. After the clinically recovered assessment, they would now then add another 14 days, which gives us around 21 days from the symptom onset before a patient is classified as recovered. Next slide, please. You would find in this slide the different recovery policies in other countries and other agencies. So we usually compare our recovery policies with other countries and agencies. But just to let everybody know, na alam naman po natin, even from the start, wala naman talagang naging standard na definition for recoveries internationally. This disease is evolving, so every time there would be definitions, there would be criteria that will be issued internationally by experts, and then WHO also would provide the recommendations, and we just try to align with whatever international evidence there is. So since the start, because of this very vague information and definition on recoveries internationally with the experts internationally, we were able to issue guidelines wherein we said that the 14 days or the incubation period of these 14 days is what we will be adopting. So we have compared our policy with other countries and other agencies, including the US CDC, the European CDC or the ECDC, Vietnam, and India. And this is the summary of this slide. So across countries, repeat testing is no longer required. So lumabas na po yan sa mga iba't ibang articles. It has been published based from international publications, except for Vietnam, wherein because they have controlled their cases initially, but now there is a resurgence of new cases. So they decided that they will go back to this testing criteria where they are now requiring 2 consecutive negative PCR tests within 48 hours para masabi na recovered ang isang pasyente. But for most recovery protocols, which requires clinical recovery as a criteria, ang clinical recovery is defined as fever resolution or symptom improvement and can be a criteria for discharging a patient from the hospital or from a quarantine facility. But if you try to find here, yung clinical criteria, hindi siya masyadong different from other agencies or countries. No? So Philippines uses clinical recoveries. Alam natin yan, no? Na kapag na-assess na ng physician, and nakita ng physician na nag-resolve na yung mga symptoms, we can already classify as clinically recovered. And that is also included in one of our department memorandums that we have issued in the past. US CDC also has that clinical criteria as well as the European CDC. But for India, they have this that they discharge 10 days after the onset or 3 days after resolution of symptoms. Now, the last column would show us the isolation criteria, and this is where differences are mostly evident. So different guidelines show the isolation criteria for recovery can range from 7 to 14 days from the onset or from the discharge. Our current policy, if interpreted as intended, based on DM 2020-0258, is generally similar to the duration of isolation of other countries. So you'd find in this slide for the Philippines, 14 days from the onset of illness, but it was interpreted as additional 14 days from the discharge. So, kaya nga pinakita namin kanina, 21 days talaga yung nagtototal, no? Yun yung common interpretation. For USCDC, it's 10 days from the onset or the specimen collection. So, for USCDC, after 10 days, tapos wala na siyang symptoms, clinically recovered, they already tagged them as recovered. And from the European CDC also, there is after diagnosing as clinically recovered, they have additional 8 days from the discharge from the hospital. So for example, if they discharge the patient from the hospital or quarantine facility on the 7th day of illness, they would still add another 8 days and it would total to 15 days. For Vietnam, there is 14 days isolation in a hospital. So that's from the onset of illness, but they have 2 consecutive negative PCR tests in 2 days before they can discharge or they can tag as recovered. And this was what we were implementing before until we changed our protocol because of the evidence that on the 10th day, a patient is no longer infectious. In India, aside from discharging 10 days after the onset of illness with resolution of symptoms, there is another 7 days from discharge. So maybe totaling around 17 days. So this is the comparison between and among different agencies and countries for our recovery criteria. Jen?
Thank you, Sec. I think we can also clarify, and these are some of the questions that we received via Viber then. No? You mentioned we can discharge if there's fever resolution. Doc, can you explain to us what fever resolution is?
Okay, pagka halimbawa sinabi natin fever resolution, fever is just a proxy of the different symptoms that the patient can experience when you have COVID-19. Alam natin, it's a range of symptoms which starts with yung iba fever, yung iba cough, yung iba colds, yung iba sore throat, yung iba even just body pain meron sila kasi para siyang trangkaso. So kapag sinabi natin na fever, yan yung proxy, pag nag-resolve na siya, ibig sabihin pwede ka na na ma-diagnose as clinically recovered even without a test. So that goes along also with other symptoms that had been identified as part of the triad or the range of symptoms of COVID-19.
So, Doc, if say nagkasakit ako, I was confirmed with COVID, and then I went through the 14 days without symptoms, how will I know na talagang wala na akong COVID or hindi na ako infectious? Kasi for the DOH guidelines, hindi na kailangan mag-test.
Yes, the safeguard there would be kahit ba nagkasakit ka na no at gumaling ka sa COVID, kailangan yung minimum health standards you still follow. So halimbawa ikaw nagkasakit ka, nakatapos ka na nung 14 days mo na isolation, you were tagged as recovered. Whenever you go out, you still follow minimum health standards. You wear your mask, you do physical distancing, you always wash your hands. Because this is something that can assure everybody no na talagang hindi tayo makakapanghawa. But it's the experts who are saying, no? And these are based on evidence. Kapag nagsabi sila that on the 10th day, talagang non-infectious ka, kailangan din lang siguraduhin na ang doktor ang nagsabi sa'yo na ikaw ay clinically recovered. We just don't decide it upon ourselves na after the 10th days, ay wala na akong symptoms, okay na ako. Kailangan a doctor can clear you and tell you that you really are recovering and you really have clinically recovered.
Okay, thank you, Doc. We are going to start fielding questions submitted to us by our media partners. From Christine Sabilio, can we get a step-by-step process on how the retagging of the 37K recoveries was done? Also, bakit isang bagsakan lang po yung reporting last night?
Yes, Christine, we already have explained, no? Natatandaan nyo, nagkaroon na kami ng mass tagging of recoveries. I think that was June 15, if I'm not mistaken. Kung saan lahat ng hindi natin natatag na mga individuals na confirmed positive, from the time that we have started reporting, inipon natin, tinignan natin lahat yung line list na yan, pinagtrabahuhan, at kinuha natin lahat ng mild na symptomatic, in-exclude natin lahat ng mga deaths para ma-mass tag natin on. And I think we've come up with around 3,000 or 5,000, if I'm not mistaken, during the time that we have reported. So this is the second round of what we had done. So alam natin ngayon, bumibilis na ang reporting because there is strengthened ano ba yan? Coordination between LGUs, regions, tsaka kami. Tapos meron na tayong COVID kaya. Another na nakapagpabilis dyan, yung ating tool ngayon, yung CDRS. No? This CDRS is the COVID-19 repository, no? Wherein ina-upload na lang nila yung kanila, kinascan nila yung CIF nila, ina-upload sa system, nakalink sa COVID kaya, pumapasok sa COVID kaya. So, mabilis na nagagawa ng laboratories natin yan. However, ang problema pa rin natin, even though we have this fast or automated system already working for them, still the details in this form, yung CIF natin, kulang pa rin. So, halimbawa, mag-submit sila ng data, positive itong individual, but marami pa rin sa reporting units natin, no? Especially yung nanggagaling sa ating local governments, hindi rin nila ina-update yung kanilang form for the outcomes of the patient. So halimbawa, the patient was identified July 1. Pagdating ng July 14, aantayin namin dapat na nakatag na siya as recovered because that's the outcome of the case. But most often than not, nakita namin hindi nila nagagawa. So ito talaga ang nakapag-lead na talagang mag-ipon itong mga number of mild na symptomatic na wala silang outcomes at all. So as I've said, lahat ng nakikita natin, that is coming from June 1. Excuse me. Kasi May 31, nakatapos tayo nung una nating batch of mass recovery. Inulit lang natin itong proseso natin ngayon para makuha natin ulit yung mga naiwan na hindi na naman nalatag. So, kaya nga sabi ko sa inyo kanina, importante na maintindihan natin yung first slide ko kanina. Pag tinignan natin, ang dami nating active cases and 99% of those active cases, these are mild and asymptomatic cases. Pero, itong mild and asymptomatic, since the start pa rin, no, hindi pa natin, nabawas lang natin dyan yung 5,000 nung May 31, nung June 15. Pero hindi pa natin nababawas dyan yung mga tao na supposedly have recovered already, pero hindi pa nga nalalagyan ng outcome sa report. So kaya yun yung ginawa nating step-by-step process where ang ginawa natin, we made sure no na itong mga severe and critical hindi kasama diyan. We made sure also na na-double and na revalidate natin yung mga deaths natin para napakaliit lang ng porsyento kung meron man maisama diyan na mga deaths, no? Pero sa tingin namin, nalinis naman namin ng maayos. So may line list kami for that and we were able to get all of these numbers at pinag-aralan at saka namin in-report. So that was the process, no? And that was the rationale why we have this. Jen?
Thank you, Yusek. From Sophia Tomacruz of Rappler, her question is, on July 30, the IATF adopted a new definition for recoveries that covered mild or symptomatic patients who finished 14-day isolations and no longer symptomatic. Why adopt this only now when other countries had this in place before? How do we reconcile this with studies that show the virus lingers longer for some patients? Yusek?
Yes, Sophia, hindi tayo nag-adapt ng bagong definition, no? So we need to be very, very clear on this. Itong ating definition na ito dati pa. Pag tinignan natin lahat ng policies natin, naandyan na siya dati. Ang nangyari, may different interpretations. Kaya tayo nagkaroon ng medyo pagkakaiba-iba kung kailan natatag ang recovered. So as I've shown you a while ago in our slides, there were different interpretations coming from our implementation units. Kaya yung tagging of recoveries, yung iba nakakapagtag ng 14 days, yung iba 21 days, yung iba minsan 28 days pa. So hindi tayo nag-adapt ng definition. Instead, we just emphasize and on this definition na dapat from the date of onset, doon tayo magbibilang ng 14 days natin for mild and asymptomatic. Also, please remember, we like to emphasize all those that we have included in these recoveries are only mild and asymptomatic patients. The moderate, severe, and critical are not part of it. So yung pangalawang tanong, yung sabi nyo na sa studies, baka yung virus lingers ng mas matagal no, sa isang tao. So, di ba ang lagi natin pinag-uusapan, based from evidence no, coming from our international experts and even USCDC and WHO mentioned this. And pag nakita natin yung kanilang protocols for tagging recoveries na andun na, no, na talagang on the 10th day, talagang dinidischarge na nila, no, based on evidence na talagang you are non-infectious. So, Sophia, you have to remember the RT-PCR machine, it detects the virus, but it doesn't tell you if the virus is infectious inside that body. So, ito pong RT-PCR machine, maaring makapag-detect, no, katulad nung kwento at experience coming from other countries. No, that's one of the reasons why they remove testing as a basis for discharging. Kasi yung iba stays in the hospitals for so long because they keep on testing positive. When in fact, sinasabi na ng mga eksperto, this might just be remnants of the virus because the patient is considered non-infectious anymore as long as symptoms have resolved. And on the 10th day, wala na talaga siyang symptoms, he is considered non-infectious already. So lagi po natin tandaan ang RT-PCR na test is a basis for infection but not a basis for recovery. Jen?
Thank you, Yusek. Also, I think, Yusek, you also shared din, di ba kanina na why we didn't global standards is set at 10 days, but the Philippines set it at 14 days. So we are on being more conservative.
Yes, so dun nga sa punto na yun, nagiging conservative pa tayo. Ayaw natin nung 10 days talaga. Gusto pa rin natin yung kompletong incubation period, makover natin para masigurado tayo. Thank you, Jen.
Right. Yusek, Sophia's second question is, can we get an update on the number of clusters being monitored nationwide and where these are located? There's a long list of this data. Maybe we can show this na lang via Viber.
Yes, please.
Okay. Gabi Parlade of the Daily Tribune is asking, we'd like to ask lang how sure are we that those mild and asymptomatic cases who did not manifest any more symptoms after the 14-day quarantine are really considered as recovered? May recent post po kasi on social media where the person daw po was notified by QC Health Office, considered as recovered na daw po siya after her 14-day quarantine, and yet when she got tested recently, nag-positive po siya ulit. Yusek?
Yes, Gabi, it's the same no, it's the same answer that I'll give to you. Katulad ng lagi nga namin sinasabi, ang dami ng experiences dito sa Pilipinas, no? We have Senator Subiri, we have si Senator Angara ba yun? But anyway, 'di ba, ang sabi nga natin, RT-PCR machine is very very sensitive, no? Talagang kahit nakaprasong lang ng part ng virus na 'yan, madidetect niya 'yan sa katawan mo. Pero ang question, infectious pa ba 'yan? So, meron na tayong mga sapat na ebidensya, kaya nga nakapagbigay na even WHO and the other recognized or reputable agencies across the world, no, nakapagbigay na ng suporta dito na ang isang tao, as long as the symptoms have resolved already at nakasampung araw na siya, no, from the date of onset of illness, siya ay non-infectious na. Yun ang ating pinangahawakan ngayon, and that is also our basis for our protocols that we are now implementing. Jen?
Thank you, Yusek. From Lines Capanti of GMA News Online, it's the same question po, but I'll ask it there. It's the same, around the same thought po. What is the wisdom behind assuming that mild and asymptomatic patients can be considered recovered after 14 days? Ano po ang naging basehan which made that assumption accurate?
Let us not call it an assumption, please, because this is not an assumption anymore. This is based on evidence, scientific evidence, and experts across the globe are already backing this up, and it's now being implemented in different countries. No? So sabi ko nga, nung pinakita natin sa table kanina, nakikita nyo na wala nang gumagamit ng testing approach para masabi na recovered ang pasyente. Katulad din ng sinabi ko sa inyo kanina, testing is a basis for infection. Para masabi mo kung isang tao ay may virus o wala, gagawa tayo ng test. Pero para masabi mo kung ang tao ay recovered o hindi natin yan gagamitin. Kasi nga, napaka-sensitive nitong RT-PCR. Even as long as 55 days nga, yung sinabi ko sa inyo kanina, nagpa-positive pero non-infectious, wala nang sakit. Na lang talaga, yung kanyang positive na lang, kaya nakadetain pa rin siya sa ospital for that long. So let us not call it an assumption. This is based on scientific evidence. That's why we have this protocol. Jen?
From Red Mendoza of the Manila Times, question regarding the spike in the number of recoveries per rin. Right now, people are still adamant that some people who have been earlier tagged as asymptomatic or mild can freely roam around or be able to talk to people 10 to 14 days after their infection. How can we assure people that these recovered patients won't infect other people once lumabas na sila sa community?
Ito naman talaga challenge. Kasi ang problema, stigmatize natin ang COVID-19 Kapag may sakit ang isang tao, ayaw natin nilalapitan and all. But we have to believe the experts. Kung hindi tayo maniniwala dyan sa mga eksperto na yan, saan pa tayo maniniwala? Wala na tayong pagbabasihan ng siyensya kung hindi tayo maniniwala. But I understand completely, Red, na talagang magkakaroon talaga ng ganitong challenge. That's why we are saying, may safeguard tayo. Kailangan lahat may minimum health standards kino-comply. So even these people who have been tagged as recovered, pag lumabas yan sa community, kailangan naka-mask yan, nag-physical distancing, nag-uugas ng kamay madalas. So ito yung safeguard natin. Because ito naman talaga ay binabase natin sa scientific evidence. And even around the globe, wala naman tayong naririnig na pumuputok na balita na yung mga tinag nila as recovered, as we are now going to do, nagkakalat ng infection sa community. So ito talaga ay talagang appropriate surveillance lang, ensuring that minimum health standards are there, and then there is also monitoring of these individuals, syempre. So kailangan, kahit na natag as recovered, maybe after 2 weeks can go back to the doctor just to check if he's okay. So meron tayong mga ganitong pamantayan at saka monitoring coming from our local health officials.
Thank you, Yusek. Just so we can finish all of the questions on the Oplan recovery, Christine Sabilio has a question posted on the chat box. Christine, would you like to ask your question?
Hi, Yusek. I just wanted to clarify lang, baka kasi hindi naintindihan ng mga tao. Do we actually check the patient, like the LGU, do they call the patient to check kung recovered na sila, kamusta na sila, na hindi lang siya like sa computer lang nag-retag actually?
Yes, there is this mandate for local health officials, no? And part of the functions of our BHERTs, the Barangay Health Emergency Response Teams, is not just to do contact tracing, not just to do the health information thing, but also to monitor individuals who have turned positive and had been quarantined at their home. So kailangan yun na namomonitor at saka na nalalaman nila kung ano na yung estado ng pasyente. Alam mo, Christine, with the way LGUs are now reacting, no, dito sa or responding to this pandemic, I think they can do that, no, because they're really really very careful dun sa mga taong may mga sakit sa kanilang lugar at saka talagang binabantayan nila.
Okay, thank you, Yusek. Okay, we can move forward with the rest of the questions submitted last night. From Caroline Bongkin of CNN Philippines, pwede po ba ibigay na DOH ang official guidelines pag may COVID symptom? Kung ang isang tao ay may sintomas ng COVID, saan po siya pupunta muna? Diretso ospital po ba for checkup and testing or sa barangay po? What is the process, Yusek?
Well, kapag ikaw ay Caroline, kapag ikaw ay meron kang nararamdaman na any of these symptom, pinakamaganda pupunta ka sa primary healthcare facility. Huwag kang dumiretso sa ospital kasi pag pumunta ka sa ospital, pipila ka doon sa triage area nila na napakatagal. So para lang maging sigurado, pumunta muna sa primary healthcare facility, and once the doctors there will assess and would say that you need to be swabbed, you need to be admitted in the hospital, that's the time that you go to the hospital. Pero I think kailangan palakasin natin itong at ma-emphasize natin itong pagpunta ng mga tao sa primary healthcare facility muna, wag munang i-flood ang ospital. Kaya rin tayo nagkakaroon ng maraming tao sa ospital, binabypass ng mga tao yung ating mga rural health units, when in fact our local healthcare officials are ready, at sila naman ay nabigyan na ng mga guidelines na kailangang ipatupad kung sakali, so they're part of this network, so dapat doon muna pumunta at i-refer na lang nila kung kailangan ng higher level facility. Jen?
Okay, I think we also need to clarify what are these primary healthcare facilities? For these clinics, barangay health centers, saan po sila diretso?
Yes, we have different primary healthcare facilities, both in public and private. So kapag public, we have the rural health units or the health centers or the barangay health stations. Meron din tayo sa private yung mga medical clinics ng mga doktor o mga private physicians na meron tayo. Meron din tayong outpatient clinics actually sa mga ospital. Kaya lang, with the expansion of our units for COVID beds, medyo yung iba, medyo nag-scale down ng outpatient departments ng mga ospital natin. So mas maganda talaga na sa RHUs na lang muna tayo magpunta para mas safe pa rin, kukonti pa rin lang ang tao doon. They can also do telemedicine. I'm sorry. We have different telemedicine providers na pwede naman na doon tayo magpapatingin to minimize face-to-face interaction. Mabibigyan kayo ng suggestion, and that's the time that you can go to another facility if so warranted. Jen?
Thank you, Yusek. We just have a few minutes left, so let me just finish all of the additional questions raised on the recovery, the upland recovery. From Jovic Yi. Jovic, you want to ask your follow-up question?
Hi, Yusek. Good morning po.
Morning.
Ma'am, yung sa, baka pwede nyo po ma-discuss yung viral load ng mga patients kasi na-mention nyo nga kanina na non-infectious na yung mga patients natin after 10-14 days. Pero yung viral load lang po para lang ma-ensure yung public na hindi na talaga sila may infect ng mga recovered patients.
Oh, well, when it comes to viral load, you need very, very specific and technical test to get that. But what we can tell you is as long as the patient is symptomatic, yung mga may simptomas na pasyente, yan yung matataas ang viral load. Kapag nagpupunta ka na dun towards the latter part of your illness, tapos gumagaling ka na, o kaya wala ka ng simptomas, pababa na ng pababa ang viral load mo. So that is one of the reasons why experts have given this recommendation at saka nakita naman nila based on studies na bumaba na, no? At yung viral load mo ay mababa na pagdating nung time na naka-resolve na ang symptoms mo. So, ibig sabihin, hindi ka na talaga makapag-infect kapag ka mababa ng viral load. Jen?
Thank you po.
Thank you, Yusek. Aiko has a follow-up question. This was discussed earlier, but we can emphasize po. Aiko, you want to ask your question, please?
Yes po, Yusek. Good morning po. When can we say that someone who's clinically recovered, does this mean non-infectious na po ang patient? And how do you determine and make sure that a clinically recovered COVID-19 patient is no longer infectious po?
Sabi ko nga, no, it's based on scientific evidence that experts have said, no? So, unang-una, kailangan clinically recovered ka. So, what is clinically recovered? Ang clinically recovered, halimbawa ikaw ay nag-umpisa sa lagnat, nag-umpisa ka sa ubo, nag-umpisa ka sa sipon, ibig sabihin, pag sinabing clinically recovered ka na, nagkaroon ka na ng resolution itong mga simptomas mo. Halimbawa, wala ka ng lagnat, no? That's the proxy, yan lagi sinasabi nila, pag wala ng lagnat. Pero may iba pang simptomas. Halimbawa, yung ubo mo, kung dati hirap na hirap ka ng umubo, ngayon pakunti-kunti na lang, tapos nung in-x-ray ka, clear naman yung x-ray mo. So, ibig sabihin, pwede ka nang matag as clinical recovered, no? So, maraming mga batayan na pwede nilang gamitin, especially for those patients who are in hospitals, no? May mga pasyente tayong nakalagak sa ospital na mild and asymptomatic na baka may immunocompromised sila or vulnerable. May mga ibang test pa na ginagawa ang mga doktor para ma-diagnose sila as clinically recovered. So ito yung pinaka-major natin na criteria para masabi natin na itatag ko na ang pasyente as recovered. Pero aside from that, we have this isolation criteria. So clinical criteria or the criteria for clinical recovery plus the isolation criteria. So halimbawa, clinically recovered ka pang 10 araw nung sakit mo, no? From the first day of the onset of the illness, we add additional 4 days. You have to complete your 14 days based from the onset of your illness, ang day 1, yun ang reckoning date mo, at saka ka matatag as recovered. Ngayon, kung wala ka naman talagang simptomas from day 1 hanggang 14 na araw, you remain to be asymptomatic and then you can easily be tagged as recovered on the 14th day.
Okay po. Attorney Jen, can I ask a different question aside from the recovery issue po?
Okay, we have you have 1 minute.
Alright po. Yusek, regarding those vaccine distribution na binanggit po ni Pangulo kanina sa kanyang speech, how can we say na talagang by December meron na po tayo, and yung vaccine distribution, is it the same po yung approval ng China pagdating sa vaccines po compared to other countries like US po, ma'am?
Kung ano yung regulatory process natin dito, yun yung mag-a-apply, no? So kahit na ano pang mga regulatory process ang ginagawa sa Amerika o kaya sa China, pagdating yan sa Pilipinas, dadaan pa rin yan sa proseso natin on regulation. Now, meron lang syempreng advantage kapag ang isang bakuna ay ni-recognize na ng isang reputable national regulatory agency. For example, US and China have NRAs, no? Ito yung mga reputable regulatory agencies. Kapag yung mga bakuna na yan, kapag pumasok sa atin, meron na silang rehistro galing sa kanilang mga NRAs, yung FDA nila yun sa kanilang mga bansa. Pag pumasok dito, mas madali ang proseso natin kapag kaganon. Pero, of course, dahil bagong mga technology ito, pagpasok niyan sa ating bansa, kailangan niyang dumaan sa lahat ng regulatory process natin so that we can ensure na ito ay magiging safe at ito ay magiging effective para sa ating mga kababayan.
Ma'am, is it possible na December, and ano po yung naging basis ng Pangulo sa 40 million doses po na ibibigay sa mga Pilipino, and will the frontliners be prioritized to be given the vaccine?
Meron kasi tayong kausap na ngayon, no, yung COVAX facility. Itong COVAX facility na ito, merong mga arrangements ang ating country with them. So, ang negotiations na yan, basta pumasok ka dyan, meron ka syempreng mga kailangan din na contribution for that. But definitely, ang bawat country will be assured, no, of 20% of their population na maaring mabigyan. But wala pang final agreements dito, Aiko, inaayos pa lang natin, and we are trying very hard, no, na makaposisyon tayo dyan because that would benefit really the country. Dahil pag dumating ang mga bakuna, we will be assured of this number of vaccines if ever. So iyan ay pinag-aaralan natin ngayon, no, especially yung target, sino ba yung mauuna kung sakaling iyan lang ang makukuha natin. Pero hindi lang naman yan ang kausap natin. May mga kausap pa tayo na ibang manufacturers. As I had been telling all of you for these past weeks and months, may kausap na tayo na 4 na manufacturers, 3 galing sa China, isa galing Chinese Taipei, no, na meron din silang mga bakuna na ino-offer sa atin, no. So yun yung meron tayo ngayon, Aiko. So yung targeting, pag-uusapan pa yan, no. Kailangan may maayos na proseso para diyan, kailangan may prioritization.
Okay, thank you, Aiko. Yusek, if we can do last 2 questions, pero that are recovery-based naman. From Caroline Bunkin, she has a clarification on the recovery, and I think it's also the same question as Greg's. Caroline, you want to ask a question?
Hello po, good morning po, Yusek. Ma'am, clarify ko lang po sana. So, based dun sa presentation nyo kanina, kapag asymptomatic, matatag siya na recovered 14 days after nung first day na siya ay matest for COVID. Pero pag meron siyang mild symptom, matatag siya na recovered from the first day na sabihin ng doktor na siya ay clinically recovered. So after that, may 14-day period pa na hihintayin. Tama po ba?
No, Caroline. Ang sabi nga natin, so kapag ikaw, yung asymptomatic, tama ka doon, So from the time that you were swabbed or the specimen was collected, yun yung day 1 mo. Kapag hindi ka nag-develop ng kahit na anong symptoms for the 14 days na ina-isolate ka, on the 14th day from the date that you were swabbed, you can be tagged as recovered already. But for those who have started with symptoms, no, yung may symptoms, mag-uumpisa yun from the date of onset of illness. Tapos, kailangan antayin mo muna na ikaw ay ma-assess ng iyong doktor na clinically recovered. Ibig sabihin, na-resolve na lahat ng symptoms mo. So kapag na-resolve na yung lahat ng symptoms mo, for example, on the 7th day, resolve na lahat ng symptoms mo, or on the 10th day, para maka-14 ka, 4 na araw na lang ang kailangan mo na kumpletohin, no? So kailangan i-add mo dun sa 10th day ka na diagnosed as clinically recovered, maybe pinauwi ka galing sa ospital or galing sa quarantine facility, kailangan mong dagdagan ng 4 na araw na isolation para maka 14 days ka. So after that 14 days, pwede ka nang matag as recovered.
Thank you po.
Okay.
Thank you. Thank you, Yusek. Last question, sorry, from Greg Gregorio. Greg?
Yes, ma'am. Hello. To Yusek Vergere po.
Yes, Greg.
Ma'am, clarification lang po on the timeline. When did we stop requiring testing as requirement for a person to be tagged as recovered? And when did we start using the protocol na po na once 14 days isolation nga po is finished for asymptomatic, pwede na siyang matag as recovered. And then yung kailangan nga po ng clinical clearance pa for the symptomatic naman.
Yes, Greg, yung clinical clearance simulat sa POL, no? Nasa policies namin 'yan. Doon sa mga protocols natin kasi doon sa nung inadapt namin ang guidelines ng PISMID para sa management ng ating mga COVID-19, kasama 'yan doon. So yung talagang napaka-importante and critical yung physician's clearance lagi para maka-discharge at saka makasabi na clinically recover ng pasyente. Simulat sa POL meron. As to changing our guidelines doon sa ating yung sinasabi natin na hindi na kailangan symptoms-based na, hindi na siya test-based. Lumabas yan doon sa department memorandum natin. I think, Jen, magpapatulong ako. Hindi ko na matrack ang time, pero that was about June.
May 29
yan, May 29, I'm sorry. So May 29, Greg, lumabas siyang policy na yan dahil nagpalabas na rin ang WHO ng kanilang rekomendasyon at yung articles nga na international evidence na lumabas na symptoms-based approach is more rational, no, in doing this this tagging of recoveries, and also experts were saying na itong ang ating testing is for detecting infection and not for tagging recoveries.
So ma'am, yung sa adoption po sa IATF guidelines, it was just to uniformalize or to have a uniform interpretation across all the LGUs na nagbabantay po. Tama po?
Yes, Greg, that's one of the objectives. So, but the basic objective of us presenting and seeking their approval is yung time-based tagging namin. No? Yun yung pinakita namin, pinaliwanag natin sa mga iba't ibang mga miyembro ng IATF kung paano natin ginawa, at saka pinakita namin kung ano yung mga ano yung report na lalabas, no? Because from a once 30+%, aabot tayo ng 72% because we have adopted this process of time-based tagging. So, yan yung mga objectives. And of course, sabi mo nga, yung pangalawa, tama yan, para maipakalap natin, mahingi natin ng tulong, especially from our agencies who are part of implementing, no? Na para magkapare-pareho tayo ng pagkakaintindi or interpretation of these different protocols that we have.
Thank you, ma'am.
Thank you.
Thank you, Yusek. That's all the time that we have today. Do you have any last messages just to recap on the recovery, offline recovery? So for mild and asymptomatics, after 14 days, if you're no longer showing any symptoms, you can return to work. Tama po ba?
Yes, Jen. So, meron tayong, we have presented to you, no, kung ano po yung ating sa recovery sa ngayon. Pagka asymptomatic po siya, after 14 days without symptoms, you can already tag as recovered. Pwede na po siyang magtrabaho. Kapag ho naman ito ay may simptomas siya nag-umpisa, ang importante na titignan natin, meron pong diagnosis or may assessment ng ating physician na sinabi clinically recovered ka na, at saka nakakompleto siya ng 14 na araw na isolation from the date of onset of illness. And after that, the patient can already be reintegrated in the community, whether magtatrabaho na siya or whether nandun lang siya sa komunidad. Pero hindi na po natin siya kailangan layuan kasi ayon sa mga scientific evidence, hindi na po siya infectious. We just need to enforce our minimum health standards.
Copy, Yusek. Thank you po. Any last messages po before we end our forum?
Yes, I'd like to thank everybody. No, alam ko po yung mga pakiusap namin sa inyo, medyo na late ang bulletin, na late tayo sa media forum ngayon. Sana napagpapasensyahan. Marami po tayong inaasikaso sa ngayon, sa dami po ng kailangan nating ayusin. Pero we hope that we can seek your support, especially now. Ito na naman tayo, nagpalabas po tayo nitong recoveries na medyo madami. Sana ho naintindihan at naiparating namin sa inyo ang tamang impormasyon para makatulong po kayo para ipaliwanag natin sa ating mga kababayan. So thank you very much, and we will again see all of you on Monday, right, Jen?
Yes, Yusek, on Monday. Sorry, I need to let you go na. Thank you very much po. For the rest of the questions,
Salamat.
okay, for the rest of the questions po from our media partners, we will be sending it to the Viber group. Thank you and happy weekend.